So next speaker is Ms. Tasneem Abu Rouza. She is a special education consultant and a BCBA, which is a board-certified behavioral analyst, providing her services at Emirates Autism Society in Abu Dhabi, UAE. And she's going to talk to us about autism and rare diseases. Ms. Tasneem, please.
Assalamu alaikum. Thank you for attending. Today I'm going to be talking about autism and rare diseases and the connection between autism and rare diseases. For the agenda, I'll give a little bit of introduction. I'll talk about the causes of autism and the diagnosis of autism and rare diseases, and what is exactly the connection between autism and rare diseases, and I'll give some recommendations at the end. So, autism spectrum disorder is a neurodevelopment disorder. It is a spectrum disorder, meaning that the symptoms and the severity, it range and is different from one person to another. So each person individual with the autism will be different than the other. The symptoms of autism typically appear in the first 2 years of age of their life, and their characteristics characterized by difficulty with social interaction, communication, and repetitive and restrictive behavior and interests. On the other hand, rare diseases, also known as an orphan disease, is a condition that affects a small portion of population, typically fewer than 200,000 people in the United States, as an example. The exact definition of rare disease is different, and it depends on the country and the population and where it was studied and the effects of the disease on the person. And because rare diseases are rare, that's why you will see that there are less and little research on rare diseases, and there will be less attention and funding than more prevalent conditions, which is normal because it's rare. This can make it challenging for patients and families affected by rare diseases to access information, support, and effective treatments. In this presentation, I will examine the connection between autism and rare diseases and discuss the challenges and opportunities for improving diagnosis, treatment, and support for individuals with both conditions. By increasing our understanding of the overlap between autism and rare diseases, we can work together, providing better care and improving the lives for those affected by these conditions. Now, if we're going to talk about, I'm going to talk about next the causes of autism. As most of you know, the causes can vary, but we do not know until now the actual real cause of autism. So the first one is genetics. Autism has a strong genetic component, and several genes have been associated with the disorder, but until now, there is no single gene have been found to cause autism in all cases. Rather, it is believed that a combination of genes may increase the risk of developing this disorder. Researchers also investigating whether certain environmental factors, such as exposure to toxins or infections during pregnancy or early childhood, may increase the risk of autism. However, there is no evidence yet, and it's not conclusive. It is also thought that the disruption in brain development may contribute to the symptoms of autism. For example, studies have shown that individuals with autism has differences in the structure and function of certain areas of the brain, which affect the social interaction, communication, and behavior. Other medical conditions, in some cases, autism may be associated with medical conditions such as Fragile X syndrome, tuberous sclerosis, and Rett syndrome. It is important to note that autism is complex and wide-range disorder, and the causes are likely to be multifactorial. While the exact causes of autism are not yet fully understood, the early diagnosis and early intervention is very important, and it has a great outcomes on the life of people with autism. So we'll jump to treatment of autism, and I'm using this opportunity to spread about autism and ABA. Applied behavior analysis is a well-established and effective intervention for individuals with autism. It is based on the principles of learning and behavior, and using techniques such as positive reinforcement to encourage positive behavior and discourage negative ones. There are several reasons why ABA is considered a good intervention for autism. Number one, it's an individual approach. So you will see that ABA is very and highly individualized to specific needs and the strength of person with autism. ABA practitioners work closely with the individual and their family to create a personalized treatment plan. Second, it's an evidence-based science. Because it's highly researched, you will find thousands and thousands of research and interventions based on this research, which also prove by data the effectiveness in improving the social and communication and behavioral skills in individuals with autism. It's data-driven. ABA uses data to measure progress and to make adjustments to the intervention as needed. This helps ensure that the intervention is effective and that progress is being made towards achieving the individual's goals. Versatility, ABA can be used to address a wide range of behaviors and skills, from basic communication and social skills to more complex behaviors like self-management and problem solving. Again, it's individualized, so it depends on the individual. Long-term benefits, ABA has been shown to have long-term benefits for individuals with autism, including improved adaptive skills and independence. Another type of treatment that is very important for kids with autism, because as I mentioned, they have problem with communication, which is speech therapy. Speech therapy is highly effective intervention for individuals with autism who have difficulties with communication. It can help individuals with autism to develop and improve their verbal and nonverbal communication, which can greatly improve their life and give them a better quality of life. Occupational therapy is highly also effective intervention for individuals with autism, as it addresses a wide range of areas that can affect ability to participate in daily activities. Because we know some kids with autism have weaker muscles, they have weaker and less ability to move and do the typical activities that other kids do, so occupational therapy is also very important. Medications can be prescribed to manage specific symptoms in autism, such as hyperactivity, anxiety, and obsessive-compulsive behavior. However, medication should be used with caution, and it might have side effects, so please don't jump to medication unless consulting with doctors. Alternative therapies. Some families may choose to explore alternative therapies such as dietary supplements, acupuncture, or restricted diets. It is important to note that there is limited scientific evidence to support the effectiveness of many alternative therapies, and many of them have lots of side effects. And from my experience, I know so many parents who went through different types of alternative therapies that had really bad side effects. So parents should be very careful when they go to alternative therapies because sometimes it can be life-threatening. Parent training and support, and there's where I come and I advocate for highly. It's very important to train and help and support families and educate them and spread awareness to help them how to manage their kids at home, how to teach them new skills, and how to work on their problem behavior. Educational and vocational support. Individuals with autism may benefit from educational and vocational support to help them learn and develop skills that will allow them to be successful in school and workforce. As I mentioned before, it's very individualized. You will see many kids with autism became young men who go to university, who will join the workforce. So it's very important to focus on these skills to help them thrive in their life. So a comprehensive treatment should be tailored to individuals with autism and may involve a combination of different treatments. Now, I'm sure many of you here know more about rare diseases than I do, but in general, there are many causes of rare diseases, and in many cases, the cause is unknown. Some rare diseases are caused by genetic mutations or inherited genetic disorders. These genetic mutations may be passed down from parents or occur spontaneously. There are rare diseases. Other rare diseases may be caused by infections, environmental factors, or exposures to toxins or drugs. For example, some rare diseases can be caused by exposure to chemicals or heavy metals, while others may be caused by viral or bacterial infection. There are also rare diseases that are caused by combination of genetic and environmental factors. Overall, the causes of rare diseases are complex and often not fully understood. Further research is needed to better understand the underlying causes of these conditions and to develop effective treatments and cures. The diagnosis of rare diseases can be challenging and often require a multidisciplinary approach. Depending on the specific diseases diagnosis may involve a range of medical specialists, including geneticists, neurologists, cardiologists, and other specialists. In general, the diagnosis of rare diseases usually begin with a medical history and physical exam by a primary care physician or specialist. The physician may order a variety of tests, such as blood tests, imaging studies, and genetic testing to help the diagnosis of the condition. Genetic testing is an important tool in the diagnosis of many rare diseases. It can identify changes in the DNA that may cause the disease. It is also important to note that many rare diseases are often misdiagnosed or undiagnosed, which can result in delays in the treatment and the management of the condition. Therefore, it's crucial for patients and families to advocate for themselves and seek out medical professionals with experience in diagnosis and managing these disorders. So the connection between autism and rare diseases, number one is the co-occurrence. Some individuals with autism may also have a rare disease. For example, some people with autism have been found to have genetic mutations that are associated with rare diseases like Fragile X. Similar challenges in diagnosis and treatment. Both autism and rare diseases can be difficult to diagnose and may have limited treatment options, particularly if they are not well understood. Lack of awareness. Both autism and many rare diseases are often not well understood by the general public, and this lack of awareness can contribute to difficulties in accessing accurate diagnosis and effective treatment. Importance of research. Both autism and rare diseases benefit from increased research, as it can lead to better understanding, earlier diagnosis, and more effective treatment. In short, there are several ways in which autism and rare diseases can be related, particularly in terms of challenges they pose and the importance of increased research and awareness. Some of the rare diseases that people with autism might have, these 7 rare diseases, there are also many more, but this is the most common rare diseases that people with autism might have. Fragile X syndrome, a genetic condition that can cause intellectual disability, behavioral problems, physical symptoms, and is one of the most common genetic cause of autism. I think around 6% of people with autism might have a Fragile X. Tuberous sclerosis is a genetic condition that causes non-cancerous tumors to form in various organs. Rett syndrome, a rare genetic disorder that affects the brain development and is associated with intellectual disability, autism, and movement problems. Angelman syndrome, a genetic condition that causes intellectual disability, development delays, and autism-like behavior. Phelan-McDermid syndrome, chromosomal disorders. Some chromosomal disorders like Down syndrome and other genetic disorders can increase the risk of developing autism. Mitochondrial disorder, which affect the function of the mitochondria, which is the energy-producing structure in the cell that have been associated with autism. There are some of rare diseases that people with autism might have, but there are many others as well. It's important to know that not all individuals with autism have rare disease, and this is my point here. And the presence of rare disease doesn't also mean that the person will have autism. Finally, some recommendations for parents of autistic people and also who also have rare disease. Seek out a specialist help. Find a doctor who specializes in both autism and a specific rare disease that your child might have. This doctor can help you understand your child's specific needs and develop a comprehensive treatment plan. Connect with other families. Reach out to other groups, and families with similar experience. You need to find a support system to help you, so you know that you are not alone in this field. Talking with others who have been in your shoes can provide emotional support and help you find practical solutions to the challenges that you might be facing. Take advantage of available resources. Look for the organizations that support you. Focus on your child's strength. It's important to focus on your child's strengths and skills rather than just focusing on the challenges. Encouraging and supporting your child's interests and skills can help build their self-esteem and improve their overall quality of life. Advocate for your child, speak up for your child, and advocate for them in school, in workplace, in medical settings, everywhere. Speak up and advocate for your child. Take care of yourself. And this is one important piece because many moms forget to take care of themselves, many parents and fathers. You need the energy to keep going. So that's my last advice and most important advice is to take care of yourself. It's exhausting, and I know it's very exhausting to take care of a child with autism. Now if they have also a rare disease, that will make it even harder. So please take care of yourself, and you as a doctor, please remind your patients and your families to take care of themselves so they can keep going. Here are some references. I have to end up and wrap up. And if you're looking for more information about autism, you can follow the Emirates Autism Society on Instagram, and also I have some resources on my Instagram. Thank you so much for your attending.
One of my areas of interest is autism, and when I moved to UAE, one of the challenges that I had was to bring this symbiosis or connection between the medical field, the medical services, and education. And I think I've seen over the last 8 years how things have changed and how UAE as a country has moved in. And what you have to say, I think, because you work at Emirates Autism Society, so maybe you can throw a little light on that.
It definitely improved. I don't know if you can hear me. Definitely there's more awareness than before. I came to the UAE in 2006. And now I worked in this field for about 20 years with autism, and you can see the parents are much more aware than before, and the social media, now with also Corona, this is the good side of Corona, that lectures been available for all parents. Parents are learning and improving their knowledge, and this is very important. But also in the medical field, unfortunately, I also know some of the doctors in the medical field are not aware of autism. And our first line are the doctors, because when the child has a problem, they go to the doctor. So our doctors, pediatricians, have to be aware of the symptoms of autism and to help and support the parents and direct them to the right direction. I think here you have a question.
Thank you very much. I am a clinical geneticist. I have several comments here. The first one is autism is a description of signs and symptoms. It is not, I don't think it is a diagnosis by itself. It is not a disease by itself. It is like what you say, pneumonia, for example. So pneumonia is just chest infection or nephrotic syndrome. So there is underlying cause. If we come in genetics, still autism considered as multifactorial in genetics. So there is some genes, their roles, and environmental factors. However, with the advances in genetic technique or genome sequencing, there are some genes is related to autism, independent of just a gene without a real cause of associated disease. So there are some genes now claimed, directed to be the cause of this. Also, with the whole genome sequencing, there is area what is called SNPs, single nucleotide polymorphism, where are some changes in the DNA leads to more tendency to have autistic behavior. The incidence in the state, and still till now, it is one affected among 160 to 66 persons. So I don't consider as a spectrum a rare disease. I think it is common. 1 out of 60 is like one affected among 3,000, or I don't know how much if you calculate it. So it is not a rare, it is, I think, common spectrum. If we come to some of underlying causes, like Fragile X syndrome, the incidence of Fragile X syndrome affects the male because it is X-linked. It is one affected among 10,000. If we come to tuberous sclerosis, it affects one among 5,000 to 10,000. So all underlying causes also, it is not rare. It is relatively common disorders. Thank you very much.
Thank you for this comment.